Hey everyone, and welcome back to Fluent with Looki, the podcast where we eavesdrop on real-life conversations and crack them open to help you level up your English.
That's right, Lookie. We take everyday scenarios like doctor's appointments, ordering coffee, or even arguing about whose turn it is to do the dishes, and dissect the language used. We're here to make learning English practical, engaging, and, dare I say, fun.
Dare you absolutely! Fun is the name of the game, Emma. And today, we're stepping into a doctor's office. It's a place we all visit eventually, and it's filled with very specific vocabulary. We've got a little scene for you with a patient named Zara and her doctor. They're discussing a persistent cough, and we'll be focusing on the vocabulary and phrases they use.
Exactly. It's a great opportunity to understand how to express your symptoms clearly and understand the advice a doctor might give. Think about it. Being able to communicate effectively with your doctor can actually improve your health outcomes.
That's a really good point, Emma. It's not just about understanding the language, it's about feeling confident enough to advocate for yourself.
Totally. So get ready to listen carefully. And remember, don't be shy about pausing and rewinding if you need to. Learning happens at your own pace. Also, try to imagine yourself in Zara's shoes. How would you describe your symptoms? What questions would you ask?
Excellent advice. So let's dive right in. All right, dim the lights. Cue the sound effects of a waiting room. Here we go.
Good morning, doctor. Thanks for seeing me so quickly.
Good morning, Zara. Please have a seat. So, what brings you in today?
It's this cough. I've had it for about 3 weeks now, and it just won't go away. It's really starting to bother me.
Okay, 3 weeks is definitely a good amount of time to see if it will pass on its own. Can you describe the cough for me? Is it dry or are you bringing anything up?
It's mostly dry, but sometimes, especially in the mornings, I cough up a little bit of phlegm. It's kind of yellow.
I see. The color is good information. Any fever, chills, or body aches?
No fever, but I felt a bit run down, a little tired, and my chest feels tight, like a weight on my chest.
All right, let's have a listen to your lungs. Sound of stethoscope. Take a deep breath in and out. Good. Again and out. Okay. Sound of tapping on chest. Do you have any history of asthma or allergies?
No, none that I know of. I've generally been pretty healthy. I try to eat well and exercise regularly.
Hmm. It sounds like you might have a touch of bronchitis. I'm going to prescribe you some cough medicine to help loosen the mucus, and I'll also write you a prescription for an antibiotic just in case it's bacterial.
Antibiotics? Is it definitely an infection? I've heard that doctors prescribe them too much.
That's a valid concern, Zara. Not necessarily, but we want to be proactive. If it doesn't improve within a few days, the antibiotics will help prevent it from getting worse. We can reassess in 3 days if you haven't improved. Be sure to take the entire course of antibiotics, even if you start feeling better. It's important to kill all the bacteria to prevent resistance.
Okay, I understand. Anything else I should do?
Yes, plenty of rest, drink lots of fluids, especially warm liquids like tea with honey. Avoid irritants like smoke or strong perfumes. If you develop a high fever over 102 degrees Fahrenheit, or if you have trouble breathing, please go to the emergency room immediately.
Will do. Thank you, doctor. I appreciate your thoroughness.
You're welcome, Zara. Get some rest, and I hope you feel better soon. Come back in 3 days if you have not improved. Let's dive into some key vocabulary. First, I noticed Zara saying she's been feeling run down. We talked about this earlier, but let's dig a little deeper. What are some other ways to express that you're feeling run down?
Great question. You could say you're feeling under the weather, which is a very common and polite way to say you're not feeling well. Or you could say you're feeling out of sorts, which implies a general feeling of discomfort or unease.
You could also say you are drained, which means without energy. Excellent alternatives. Okay, what about phlegm? You gave a great definition before, but why is the color of the phlegm important information?
Ah, that's a key detail for doctors. The color can indicate the type of infection. Clear or white phlegm is often associated with viral infections, while yellow or green phlegm can suggest a bacterial infection. Although it's not always definitive, it gives the doctor another clue.
Interesting. So even just describing the color can help the doctor make a more accurate diagnosis. Now, what about the phrase to pass on its own?
That's a common phrase doctors use. It means that the illness will get better without any medication or intervention. Sometimes your body is perfectly capable of fighting off a cold or mild infection on its own. That's why the doctor asked about the length of the cough before immediately prescribing medication.
Makes sense. Okay, another phrase I noticed was the doctor asking if she was bringing anything up. We covered this before.
Yes, bringing anything up is a polite way to see if a patient is vomiting or has mucus or phlegm.
Right. It's more gentle way to ask question regarding to throwing up. Okay, now the doctor also mentioned bronchitis. This is something we can talk about more.
Bronchitis is an inflammation of the bronchial tubes, which carry air to your lungs. It often causes a cough, and sometimes you'll produce phlegm. It can be caused by a virus or bacteria. What are the symptoms, Looki?
Good question. Symptoms can include a cough, shortness of breath, wheezing, and a low-grade fever.
Exactly. Now, what about to be proactive? The doctor mentioned they want to be proactive with the antibiotics.
Right. Proactive means taking action in advance to prevent something bad from happening. So in this case, the doctor is prescribing antibiotics to prevent the infection from getting worse, even if they're not 100% sure it's bacterial. It's like playing offense instead of defense. Are doctors normally proactive about these things, Emma?
Not all doctors are proactive. It depends on their individual approach and the specific situation. Some doctors prefer to wait and see if the condition improves on its own before prescribing antibiotics, while others are more likely to prescribe them preventatively, especially in cases where there is a risk of complications.
I see. Lastly, let's talk about irritants. The doctor advised Zara to avoid irritants like smoke and strong perfumes.
Irritants are things that cause irritation or discomfort. In Zara's case, smoke and strong perfumes could irritate her airways and make her cough worse. What are some common irritants to avoid?
Besides smoke and perfumes, other common irritants include dust, pollen, pet dander, and certain chemicals.
Spot on. So, to recap, we covered rundown and its alternatives, the importance of phlegm color, bringing anything up, bronchitis, proactive, and irritants. That's a solid vocabulary boost.
Absolutely. And we also touched on the importance of being specific when describing your symptoms to a doctor. The more information you can provide, the better they can diagnose and treat you.
Exactly. Remember, your health is important, and effective communication is key to getting the best care possible.
Well, that brings us to the end of today's episode. We hope you found it helpful and informative.
Don't forget to subscribe so you don't miss our next deep dive into the English language. And let us know what scenarios you'd like us to dissect in future episodes. We're always looking for new ideas.
Thanks for listening, everyone.
Bye for now.